Healthcare summit last week. You know, when Republicans and Democrats sat down together to hash out the healthcare bill last week at the Blair House, a lot of ideas were thrown around. Take a listen.
Let me just make this point, John, because we're not campaigning anymore. The election's over.
I'm reminded of that every day.
That's the 2,400-page health care bill. Is that right?
Well, actually, Mr. President, this is the Senate bill along with the 11-page proposal that you put up online that really, I think, is the basis for the discussion here.
The only thing bipartisan will be the opposition to the bill.
I say to my friend Lamar, who I have great respect and admiration for, you're entitled to your opinions, but not your own facts.
How many times have we heard that soundbite in the last month? Meanwhile, right now we are joined by our own Fox and Friends Healthcare Summit that we have convened. Playing the politician, Virginia Representative Eric Cantor. The attorney is Tamara Holder. The doctor, Fox News medical contributor, Sonara Coomer. And the patient, a disabled Marine veteran and town hauler, David Hedrick, who joins us today from Portland. David, let's start with you. What did you think of the Healthcare Summit last week? Get anything accomplished?
No, I don't think much was accomplished. I think that what they need to do is scrap the whole thing. For some reason, Barack Obama seems to think that taking a Democrat House bill and adding it to a Democrat Senate bill somehow gives you a bipartisan bill. And the fact is that it doesn't do that.
All right. One of the things, I think Tom Coburn had the idea, why don't we have undercover patients to control fraud and stuff like that? Eric Cantor, you're a congressman. You were in the room at the time. That seems like a pretty good idea, doesn't it?
Well, Steve, anything we can do to try and improve the efficiency in our system. I mean, right now we've got, I think they're saying, about $150 billion a year associated with fraud in our system. So I think Dr. Coburn's sort of suggestion may be one we ought to look at.
Okay, Sonara, what do you think?
Listen, I don't think it's necessarily a bad concept to have undercover patients. The critics of this are going to say, well, listen, you know, we're going to now be very nervous about, doctors are going to become very nervous treating patients because they're going to worry if this is a real patient or not a real patient. I don't think that's going to happen at all. The reality is that they're already using undercover patients for sting operations. The issue is that hospitals and doctors' practices need to have good compliance programs so that doctors are billing correctly and the hospitals are billing correctly, because you also want to catch errors as well as you want to catch the fraud as well.
All right, Tamara, what do you think?
I think this is the most cockamamie idea I've ever heard of. Now we're criminalizing the practice of medicine. So are we going to have like federal agents go in and like fake an injury and see what the doctor orders? This is ridiculous. This
How do you control fraud then?
Medicine.
How do you control fraud?
You control fraud by making sure that doctors don't have interest in labs. You control fraud
Why don't they do that now?
By monitoring. Excuse me?
Why don't they do that now if it's such a good idea?
Well, I think that they should. They should do that. But as far as criminalizing the practice of medicine, it's a stupid idea. And you have to look at the procedure. How is this going to be implemented? It doesn't make sense.
All right. We're going to continue this spirited debate straight ahead. Our healthcare summit tackling malpractice reform, since nobody else seems to be doing that. So we will continue in just a minute. But first, on this day. Continuing now with the Fox and Friends Healthcare Summit, Congressman Eric Cantor joins us live here in the studio. Attorney Tamara Holder, Dr. Sonara Coomer, and disabled Marine veteran David Hedrick. He joins us today from Portland. Tamara, let's start with you on this. You touched on it a moment ago. Why won't the Democrats include malpractice reform or tort reform in their health care bill?
Well, I think that there's no need for tort reform. Remember, 97% of all cases, yes, 90% of all cases studied by the Harvard Law Review stated that they were meritorious. There are 98,000 people who die a year from medical error, preventable medical error. Tort reform is just another way of the Republicans acting like they want to come to the table, but really, in fact, they don't want to come to the table. Like you said, or one of the guests said earlier, they want to scrap the whole thing.
Let's talk to an actual doctor who's sitting right next to me. You heard that. What do you think?
Look, this is absolutely a time that we need to be passing tort reform. It is not about the money that will be saved. Oh, actually, it is that's part of it. Part of it is that we're going to be saving millions and millions of dollars, billions of dollars by including tort reform. How much money is going to be saved? Billions of dollars. It depends which study that you want to look at. But the point is that it's about time that we had tort reform. Physicians have to stop being extorted because of the fact that they do procedures on patients, and the patients sign consent forms that are known risk factors. For example, if a patient has a breast reconstruction, she has a tram flap. It's a known complication that she may have a hernia, but yet nothing stops that patient from bringing the doctor to the court when even though she signed the consent form, she's been informed of the
and what
risk factors.
happens when the doctor removes the wrong breast?
Tamara, stand by. Hey, David, let's have you weigh in on this. You were watching the healthcare debate on Thursday from Blair House. The Republicans are talking about, let's just go, we've got a 6-point plan. Let's go incrementally. Let's change the healthcare system. The Democrats are saying, let's change everything at once. What do you think is a more prudent idea?
Well, I think going after the things that will actually reduce costs are more prudent. And that's the Republican plan. The Democrat plan, it does nothing to reduce costs. It'll increase costs, and it'll bankrupt the industry. You know, when I decided to run for Congress a couple months back when this whole thing happened. And since I did, you see the influences in the special interest trying to buy influence with someone who's running. And if you want a reason why the tort reform, the answer that it will not happen, I can give you a billion reasons. Because $1 billion is what the Democratic Party has received in the last 10 years. That's what Democrats have received, according to the FEC, from trial attorneys. Obama received $46 million in the last election from trial lawyers. They own that seat. He doesn't own that seat. They're just letting him sit in it. There's no way they're going to allow tort reform or take any kind of serious action to reduce costs.
Exhibit A, ladies and gentlemen. And before you go, Eric Cantor, if the White House is talking about, it sounds as if they're going to proceed with health care, which means they're going to have to use reconciliation, which is a simple majority of 51. If they do that, as Nancy Pelosi said yesterday, hey, Democrats, you're going to have to stand up here even if you lose your job. If they ram this through via reconciliation, will a whole bunch of Democrats lose their jobs?
Steve, unquestionably, the Democrats, a lot of them will lose their seat. It is my belief that the Democrats will lose their majority in November if they ram this thing through without any bipartisan support.
All right. We're going to have to end it there for today. This was a great healthcare summit. We actually got some stuff done. Let me thank the people here in the Brady Bunch boxes. Politician is Eric Cantor, a Republican from Virginia. We got the lawyer Tamara Holder and the Dr. Sonara Coomer and the patient David Hedrick, who joined us from Oregon. We thank you all for joining us live. Thank you.
Thank you.